Dr. Auerbach, let's talk wisdom teeth and all the dogma which goes with it. I mean, tell us, why do wisdom teeth have to come up, and why is there such a bad reputation about, basically we all are fearful of going to get our wisdom teeth taken out. Well, the ones who don't have it done yet. So go ahead and tell us about it.
Right. Well, over the evolution of man, the jaw has gotten smaller. So most people, probably 90%, don't have a jaw big enough to fit all the teeth that are once needed to be in there. So the wisdom teeth end up not coming into their proper spot or not coming in at all. The reason you want to have them evaluated is because problems can arise if they don't come in. You can get cysts around them. They could come in part of the way and put pressure on the tooth in front of it and create a problem with that tooth, and then you need to have both teeth taken out. So you definitely want to have them evaluated starting, maybe 14 to 16 years old, to see if the jaws are big enough to have them all and what can be done about them. Now, as far as taking them out, if you get to them early before the roots have formed, they kind of scoop out. It's a little bit more that you have to go through the gum and the bone, but it's easier in that there's no roots there.
I see. So what is it all about, it being so painful and such a major surgery, and you're like out of commission for a few days? Is that still happening, or not so much anymore, the way we do surgery now?
Usually the surgeries now, I don't hear that as a problem. You're going to be sore for a couple of days, but usually you can go back to work right away the next day. You don't want to do a lot of vigorous stuff. You want to allow, blood clotting. Anytime you have an open wound, you don't want to stress that area to create more bleeding. So you just want to take it easy for a few days. But usually you can go back and do anything the next day, maybe 2 at tops. We don't seem to have those problems where people complain, I was sore for a week or whatever. It's usually only soreness for a day or two, but not really anything that creates a problem where you can't do normal stuff, except for, exercising, stuff like that.
Got it. So basically, on an average, you can go back to work next day, and if you're a little worried about not being able to do that, do your surgery on a Friday, be okay on Saturday, have a decent weekend, and you're totally perfectly okay for whatever is coming up next week.
Yeah, that's the majority of cases. 99+% are that way.
Beautiful. All right. Now, is there you're doing wisdom extractions in your office, right? I assume.
Some cases. Other cases we do send to a specialist.
Okay. So is it good for people to do the wisdom extraction? You might have mentioned that, but I kind of lost it. To do it as soon as possible, as soon as the dentist says, look, this is coming up, you better do it now. Basically, it's an operation one way or the way which you better do young than old. Is that?
Yeah. For a couple of reasons. One, as you're younger, in your teenage years, your healing is usually faster and quicker. There's less trouble. The second reason is because of the formation of the tooth. If there's not enough room for the tooth to come in, when it's trying to grow, that's how it comes in, is when it's growing from the roots. But if it can't come in, then the roots will actually grow down through the bone and get closer to, maybe a nerve on the bottom area or up to the sinuses. And when the roots are done like that, they get more curved, and you can have more complications with taking them out if you wait too long. So definitely better to do them earlier.
Mm-hmm. Good. Well, thanks a lot. So definitely something. And by the way, do people really get more wise when they get them? I mean, and the ones who don't, no?
No, it had nothing to do with smarts that you would get with them. It had to do with, that's what they called the age of wisdom, where they would come in at about 18 years old, and that was considered the age of wisdom, and that's why they called them the wisdom teeth. They won't have any effect on your brain power or your brain or how smart you are.
So any chance that a 50-year-old guy like me can still get into the age of wisdom if he missed the first round?
It's never too late, Helmut.
All right. Thank you very much. That's encouraging.